And the night before, I had gotten to the point where I was sitting up in bed and I had pillows behind me trying to breathe. And I was gasping for breath all night long.
She was actually in pretty bad shape. She didn't look like she could even say a full sentence without having to stop to catch her breath. Certainly couldn't walk across the room without having to stop. And so we call that pretty advanced heart failure, where people can't breathe to do simple things. We found that not only did she have a severely leaking mitral valve, she also had a leaking tricuspid valve, which is another valve that can start leaking, especially when the mitral valve is bad. What she had also that was a little tricky was she had a fair amount of calcium around her mitral valve, which makes that type of surgery a lot more risky. And then the third thing, we actually found her aortic valve, which was a third valve, was leaking, probably at least a moderate amount. The additional complexity was that her heart function had become weak. And I think that was likely due to the valve leakage, but also from atrial fibrillation, which is an irregular heart rhythm, and your heart was going quite fast, and the heart pump gets weak when that happens. So one of the things that can happen when your mitral valve leaks is you build up calcium around the valve. It doesn't happen in all patients, but in some patients, they get calcium and it can be pretty significant, and it can make the valve surgery a lot more tricky and a lot more complicated. Oftentimes, we have to just replace the valve because there's so much calcium. In you, which was a nice thing, we literally detached your valve, pulled out the calcium as a big bar, and then reattached your valve in order to repair it.
I don't remember a lot of it, but when I did start coming to, the ones that were taking care of me, they would help me in any way that I needed help. You don't find that help everywhere.